Hi, my name is Dr. Eleni Rizakos, and I am a pediatric psychologist here at Children's National Hospital in Washington, D.C., within the epilepsy program. I provide outpatient and inpatient therapy services on an individual basis to our youth with epilepsy, as well as consultative services in our epilepsy clinics. Today, we'll be talking about epilepsy and mental health. My child was recently diagnosed with epilepsy. What can I do to emotionally support them? Well, I think first things first, creating an environment in which you talk about epilepsy openly and honestly is very important. You want to try to educate yourself so you can feel prepared to answer questions and provide support. You want to encourage your child to share their diagnosis with family and or friends so they can start to build their larger support system. If they feel nervous to share their diagnosis, you want to practice it at home and also have them just continue their engagement in activities that support emotional well-being, like extracurriculars, hobbies, and family activities. Okay, next is how can I help my child who is anxious about having a seizure while they're at school? I think you can go ahead and let them know that the school has a seizure action plan so your child feels confident that those around them will know what to do if they have a seizure in front of a friend at school. You also want to encourage them to share their diagnosis with their friends at school, which can help sort of decrease that anxiety about having a seizure in front of people. You could also have your child create a school coping kit, which can include comfort and distraction items that they can use whenever they need them. These items will be different for each child depending on their interests, but some common ideas include using your five senses, things you can taste, touch, smell, hear, and see, such as smelly lotions or small hard candies, books, fidgets, and headphones for music. Most importantly, make sure your child continues to attend school. So anxiety about having seizures at school often causes kids to want to avoid school, and avoiding things that feel anxiety provoking actually causes anxiety to grow. So exposure or engaging in the things that feel anxiety provoking, in this case, going to school, will actually cause the anxiety to decrease over time. Can you provide some tips for helping build self-esteem with my child who has epilepsy? So when a child is diagnosed with seizures, it often feels like life is changing, that everything is changing. Seizures can feel like they are in the driver's seat of your child's day-to-day, and the child is just sort of in the passenger seat, kind of stuck going along for the ride. So what we want to do is sort of switch that around. So the child feels like they're in the driver's seat of their life. So you can do this by having them take control of their daily routines, like taking medication on their own. You want to have them maintain or establish friendships and engage in extracurriculars that they enjoy doing. So routines, socialization, and activities create opportunities for children to accomplish things and feel successful, so that they feel like they are the boss of their day to day. It'll also be important for parents to praise their child's successes, both small and large. Are there any signs I should be looking out for in my child for depression or anxiety related to their epilepsy? I think that everyone feels sad or worried sometimes. This is a normal part of being human. However, if you notice that they appear sad or worried more times than not, or if you notice that the sadness or worry is interrupting their functioning, such as academics or extracurriculars or socialization with friends or family, then this may be a sign that your child is experiencing symptoms of depression or anxiety. If you notice this, your next step would be to find a therapist to conduct an initial evaluation to further assess these challenges and determine a treatment plan. You can find a therapist by asking your neurology provider if they have any recommendations. You can also call the behavioral health number on the back of your child's insurance card and have them have insurance provide you with a list of in-network therapy providers. How does epilepsy affect a child's emotional development? So reports do show that rates of anxiety disorders, depression, and ADHD are significantly higher in epilepsy populations when compared to general populations. However, we also know that when children go through challenges such as an epilepsy diagnosis and learn to get through them successfully, that's actually when resiliency develops. So this then puts them in a stronger place to know how to bounce back when they encounter other challenges in their future. So keeping an eye out for emotional and behavioral challenges and obtaining mental health intervention early is a key way to supporting your child's emotional well-being and building that resilience. Thanks so much for listening. If you want to reach out to our department, you can give us a call.